Hi Leah. Thanks
Hi, Lisa.
for thanks for checking in, touching base now that you're starting to settle in at Melbourne, ready for the FOP Australia conference. Um, I'm assuming it took a lot of organising and work to get yourselves over to Melbourne, and I'm wondering what were some of the things that you needed to prepare ahead of coming over to the conference, and what sort of things have been taking place for everybody as they're all arriving, and I guess what are you needing to do to settle in and get ready for the conference?
Yeah, okay. Thanks for having me on here, Lisa. The conference we're talking about is the FOP Australia 2025 conference. It's the first conference that's taken place in 10 years. And FOP is a rare medical condition, and it stands for fibrodysplasia ossificans progressiva. And I myself, yeah, I am in Melbourne, arrived on Monday for the conference. And one of your questions you asked me is like, what has it taken for us to get here? And I guess it's what has taken, I guess, FAP Australia to get us here to this point in 10 years is a lot of work. I'm hearing from the FAP Australia organisation. It's been a long time in the planning. I'm very excited to have the opportunity to bring Australia and New Zealand together with international clinicians, specialists, and the pharmaceutical companies across this rare opportunity for us all to be together. So I think we call it like an FOP patient conference, a family gathering, an opportunity for the very rare, people to come together. Just to explain, I guess the rarity, which is FOP, there's at 900 known cases at the moment globally in the world, and there's only a very few FOP people in Australia and New Zealand coming together.
So what did it look like planning ahead, um, having to arrive a few days prior to the beginning of the conference, having to settle in? What types of things are the families all saying, they've had to navigate either before getting flights or driving over, and then types of things that they're all having to organise for their accommodation, and of course everybody having very varying needs. What are some of the things that you're hearing from everybody that they've had to do in their planning?
And I guess one of the I guess the first and foremost is the ability or the I guess it's funding. It's not just funding. It's not just the cost. It's also the navigating the logistics of traveling, interstate, and I guess Adelaide to Melbourne or Sydney to Melbourne doesn't sound like a great distance or for most people just jump on a plane and off you go and book your accommodation and you're there. Planning for someone with FOP who has it's a life limiting or limiting condition where muscle, tendon, connective tissue turns to bone. So there's a lot of, fusion, limbs fused. I guess the complexities about traveling is some can travel by road and some people that's the only option. Others can travel by plane, but you can imagine having just a disability, let alone FOP, traveling by either of those means, especially by plane, means traveling from your home to the airport, from the airport, getting onto the plane safely, getting all your equipment as well. You may have a wheelchair, motorized wheelchair, a manual wheelchair, need other aids and assistance, I guess other equipment, whether it be some oxygen or some have feeding needs or needs to be fed. There's a lot that goes into organising just to get on that plane and just to get in the air and just to land. And then there's the accommodation, being very mindful and aware of what it is a person with FOP would need once they arrive at their accommodation.
So when you're arriving, is everything there ready, or were you having to all I guess, make that contact, organize any kind of equipment or um, like special bathrooms or beds or um,
Fortunately for us, for a lot of people, New Zealand, Australia, FAP Australia have well thought of that and made some of those provisions easily accessible. For example, bed hire, mattress hire, room. They've sourced accommodation. Not always would that accommodation suit everyone with FAP or every family dynamics. Perhaps you're traveling with mum, dad, other siblings, or carers. Some people are traveling on their own with their carers. So for some families, it's alternative accommodation to what had been arranged. Either two-bedroom units or having the ability to hire a vehicle that's disabled vehicle, the means to parking, and then bathroom and accessibility bathrooms. Hoists sometimes are a definite need for some people with FOP because they are fused in limbs and are unable to maneuver and manage themselves around the place. Beds, definitely beds, pressure relief mattresses, shower aids. Let me think. I don't know. Well, I've yet to really meet. We're yet to meet other FOP families yet. So the conference begins on Friday and goes through on Saturday and Sunday. Some people are already here in Melbourne. Like I said, we arrived on Monday and starting to gather together and have conversations and chat. Yeah, it's taken a lot. It's a lot. Yeah.
so how does FOP how do they do their fundraising with it being, I guess, such a rare diagnosis? Uh, how do they go about their fundraising and what a great opportunity to have this in Melbourne to raise awareness and inform the community and to try and help, I guess, rally up support for the FOP community and organisation.
Yeah. I think due to its rareness, like I said, there's only a limited number of people in New Zealand, Australia. Fundraising is really tough because to fundraise, you need to have one, like you said, awareness, but also, that knowledge. It takes a long time and a lot to understand and explain the condition of FOP. Um, and because there is only a limited amount of people, there's only, you know, limited funding opportunities. It's a lot of fundraising. Fundraising is hard when you're caring for someone with FOP or if you have FOP. A lot of fun runs they do, bingo nights, but you know, we're talking little funding, not a lot of funding comes through in a year. I'd have to, FOP Australia be able to answer those questions too. But there is a website called FOP Australia, and there's opportunities there to donate. We're always welcome to, have fundraising ideas and the likes. But yeah, we are fundraising for. It's called #Cure. There is no cure known for FOP as yet. There is no known cure. There's a few drug trials happening at the moment, and other pharmaceutical companies getting on board. But yeah, there's a lot of work and I guess advocacy and sharing of information for those to
Mm.
take.
I was having a look at their website and I also see that they have a lot of merchandise on there as well to sell and help raise some funds as well. Mm. And the bracelets.
Bracelets, pens. There's a lot of stuff, yeah, to help fundraising. But FAP Australia are fantastic at guiding anyone who's interested in raising some funds and creating awareness. Certainly, absolutely creating awareness is really so very important for FAP. To lessen, I guess, the trauma through biopsies or testing or unknown. The best thing for a person with FOP is actually to get a diagnosis. It is so very important.
Yeah. So in the I was having a look at the FOP conference program, and we so you and I are going to touch base at some stage over the weekend and just have a quick catch up and see how things are going over at the conference. I know myself and some others are going to Zoom in and
Like,
and yeah, we'll get to listen into some of the information. Um, so Friday sounds like a good day. Um, they've got their displays and resources. There is some opportunity for the families and clinicians and people to meet and catch up. There's also, it says here, NDIS expert available. Um, there's some FOP Australian research projects, and then looks like there's a formal event towards the end of the day in the evening. So Friday looks like networking, connecting with clinicians and other FOP people and families. That sounds like that would be really interesting, a good opportunity to talk to everybody.
yeah, absolutely. Some other FOP people or patients have never met another person with FOP. So, and other families never met other families with FOP. So I think, it not only is it a wonderful opportunity for global, international specialists to come together. Some are attending in person, others are online through Zoom, and FOP families and FOP people have an opportunity to write in questions prior to Friday, Saturday, Sunday. You know, it's there's dentists, there's skin specialists. Oh gosh, let me think. Uh,
Says
dentist, skin.
here on Saturday, they've got the FOP research landscape, what we know, what we have to learn. Um, International Clinical Council on FOP guidelines for management, lung health trials and treatments, um, what to expect when you're enrolling in a clinical trial, managing pain, that would be so important, wouldn't it? Skincare also talks about what does a doctor need to know about FOP, uh, which I assume something so very, very rare. All doctors are not going to learn about this at university, are they?
No, and that is something that I'm hearing a lot of FOP families say is that just that beginning again at every conversation is the begin again conversation, repeating yourself over and over again, which is explaining what FOP is, and I guess what what you can do and what you cannot do, what the guidelines and principles around caring for a person with FOP is. But yeah, often people say, "Oh gosh, we've never heard of that," and it is because it is so rare. 900 people in the world, and it is so rare, and it's not research, which I understand. We understand. We all understand that.
Yeah.
We want our doctors and our nurses and our researchers to be researching things that are very common, and that's so very important. But also too, we all feel very important too that it's creating awareness, bringing communities together um, is so important. You get doctors talking, and they get quite intrigued, especially a rheumatologist, a bone specialist, get very intrigued. Physiotherapists so intrigued, chiropractors so intrigued. This is such a rare condition, and it's really intriguing, but at the same time, yeah, really tough one for people with FOP and families.
Mm. I noticed that one thing I like is that during the topics of discussion, almost everything has time allowed for questions and answering and those discussions. And it looks like it'll be quite interactive. It's not just people sitting there listening. It's everybody having a chance to ask their questions and get answers, which is
Yeah,
so good.
yeah, you're right, Lisa. I think it's not a one-way conference. It's an all-encompassing conference, which is we learn from specialists and researchers, and they're going to learn so, so very much from everyone that attends. From what I've heard, I think there could be anywhere up to 11, which people with FOP attending. Now, that doesn't sound too much. 11 people at
Yeah.
a national conference, but that is a huge number of people um, attending, some young and some people who have been living with FOP for quite some time. And I think that's really important. We come together and talk about what has worked for, maybe what hasn't worked for a 5-year-old, what, and 10, and then you go to 15, and then you get 25 or 30-year-old. There's so many variances of those conversations that are going to help each other. Especially for the younger ones, I think some of the teenagers asking questions to the older
Uh-huh.
um, people, what was it like when you were 20? What was it like when you were 25? Could you drive? And I don't know, there's a lot of questions. I think there's a lot of support and families, just a language that is kind of unspoken. I think it's going to be so, so important.
Yeah. Should people assume that everybody living with FOP has the same, I guess that same level of challenges or disability or the same ability? Do they all progress at the same time, or is every individual unique? Are they all?
Yeah, from what I've heard it is a very unique experience for a lot of people living with FOP. The advancement of I guess, their disease is different in each person. There's also called FOP variant,
Mhm.
which is a variant of FOP. So it's FOP classic, which is what we see when we look up FOP. But there also is a variant, which is a milder form of FOP, but equally the same, like equally as challenging. Yeah, but yeah, the advancement of FOP can be very different from one person to the next. FOP, when it begins, can be a different age too. Some people will get maybe FOP awake at a very early age, young, pediatric, or others can be a lot older. So it's very different, yeah, and different in the way it presents to and in what way a person is affected with FOP.
So would that make it hard for perhaps babies or young children to be accurately diagnosed? Is
Yeah,
it something that's easy, or does that make it even more challenging because each case is so unique?
yeah, really challenging. That's something that's always spoken of is challenging to get that diagnosis. Misdiagnosis is often present with people with FOP because it does come with a stiffness or a flare up, like an area of that person's body that becomes inflamed prior to the muscle turning to bone. And it can be misdiagnosed because it is so rare. And yeah, and that also obviously misdiagnosis with anything and especially they've had people causes more trauma harm if you're doing biopsies or doing testing if you're not looking for FOP.
Mhm. So we'll connect again on the weekend, in between conferences and discussions and things. Um, in the meantime, would you suggest anyone seeing the video, perhaps they check out the conference website, um, have a bit of a read on there, maybe even do some Googling and see exactly what it is that we're talking about and what it is that's going to be up for discussion at the conference?
Oh, absolutely, Lisa. Like I think we all know by sharing information, having conversations, discussing these tough topics, and FOP in particular, especially now, like it's happening now. It's a buzz. Yeah, absolutely. Jump on to the FOP Australia website, have a look. And you also too, Lisa. Thank you so much. I mean, your advocacy page, sharing, just having this opportunity to do a video with you and talking FOP and then checking back in with us and families. I don't know, maybe others might like to talk to you as well.
That
Um, yeah, thank you.
So I will we'll be in touch, and at some stage during the conference, we'll have a quick catch up, a quick chat.
Yep, and I'll hopefully have some more information and some other resources and things. But yeah, thanks again.
Be
Thanks for your
really
support.
good. Thanks, Leah. Bye.
Bye.